Hi, this is Robert Burke. I'm one of the plastic surgeons at Ponte Vedra Plastic Surgery, and today we're going to talk about facelifts. Nancy Woody, my longtime patient coordinator, has actually volunteered to be my model today. Not that she needs a facelift, but she does have some anatomy that I can draw on and kind of help inform everybody about facelift surgery. So first of all, when we're looking at the face, we're evaluating several different aspects. We're really looking at several different areas about the face, and I really have about 5 or 6 different facelifts depending on what the patient's desires are, what their anatomy is, what the recovery time constraints are, and everything. So one of the first things that patients often come in for a facelift surgery, and Nancy really doesn't have much of this, so I'm going to exaggerate this, is kind of the jowl area. And the jowl area occurs because the deeper facial structures relax over time, and this tissue starts to fall forward and creates kind of an irregular fullness, kind of distorts the jawline as well. So the jowls are one of the areas that are primarily improved with the facelift. The other area that sometimes we look at is the lower third of this nasolabial fold. That also can get deeper as with facial aging, and that's an area that responds nicely to a facelift surgery. So kind of the jowl, the lower third of the nasolabial fold. And then you can do a mini facelift without doing a neck lift, but you can't really do a neck lift without doing at least a mini facelift. And the reason for that is that as we bring this skin up, you see this irregular contour and fullness in front of the ear, and that's something that the only way really to get rid of that is with a mini facelift. So I have wiped off the preoperative markings I made, and I kind of want to show you how we go about creating the improvement of the facelift. And there's a couple different ways to plan the incision, but I really like to follow all the hills and valleys of the ear because I think that really heals better and makes it more difficult to find those scars. And so one of the most important things with facelift surgery is this sideburn. We don't want to move this sideburn too high up in the hairline or up above the ear because that's kind of a dead giveaway for a facelift. So one of the things we do is we can kind of see where her hairline starts. So we want to kind of preserve that hairline there so that we don't move up her sideburn. We usually do start a little bit up in the hair, and then I like to follow this curve that's in front of the ear, and then we actually tuck it inside this so it's almost behind this flap of skin here, and then there's a line where the earlobe meets the face, so we hide it right in that line. And then on the back side of the ear, we actually it sits in the valley of the ear itself and comes on the back valley of the ear. And then we take this up, Nancy, if you turn just a little bit more. We take this up pretty high, and then we come back up here into the hairline. So really by following all those hills and valleys of the ear, it's very difficult to see or find that scar. And even if somebody back here behind the ear, you really almost have to peel the ear forward to see that. And then this part is back in the hair, and that's really where we're going to be moving the neck skin up and out in that direction. Now we're going to talk a little bit more about the neck. And there really are 3 things that make up the contour of the neck. It's the amount of skin that's here, the amount of fat that's between the skin and the muscle, and then the underlying muscle position of what's called the platysma muscle. And we really kind of we can deal with each of those things separately depending on what the patient has. If it's just fat with good skin and good muscle, we'll make just a small incision underneath the chin and we'll do some liposuction. And then the skin's gonna be tightened because we're gonna be taking this extra skin up and out in this direction. Sometimes you'll see patients, and Nancy thankfully doesn't have these, but sometimes you'll see patients that have these bands, and these are kind of the edges of the platysma muscle. And sometimes you can see that without fat, sometimes that's there with fat. If there's no fat, then we don't have to do the liposuction, but what we do like to do is we like to actually sew the upper portion of these bands back together so that it can give us some tightness in the upper part, and then we actually kind of divide the lower portion of those bands so that you don't have that visible band creating a line or cord. And I'm going to show you this here on another drawing. So this is kind of a facial animated drawing of the muscles, and here you can kind of see these edges of the platysmal bands. And this small white structure here is called the hyoid bone, and that's kind of the apex or the deepest portion of the neck. And so we actually like to sew these muscles back together above the hyoid, and then as we said, we release the bands here below. So here's kind of that same patient here, and this is where we would tighten the muscle above and we would release the muscle below to give us some, nice, kind of what I say, a 90-degree angle to the neck. And again, if there's fat there in between, we would suction that as well. I do want to show this diagram, but going back to kind of the facelift portion of the procedure, is previously facelifts back in the 40s and 50s, they were done just by pulling on skin. Now, the best facelifts are usually done in a deeper plane, or at least in what's called a sub-SMAS plane. And what the SMAS is, this diagram is the diagram of the facial muscles. And what we do is we will actually come underneath the edge of this muscle, and we actually lift the deep layer all the way down to here, and we then pull this up in this direction, which is what helps improve the jowl. It helps improve the nasolabial fold, and then with the skin going up and out in this direction, it also improves the neck contour as well. So this is when you read or patients are talking about, or surgeons are talking about a sub-SMAS or deep SMAS facelift, what they're talking about is going in this deeper layer of the face where the muscles are involved, and that's where you really can move significant tissues in that direction. One of the other things at the end of the procedure, usually we wrap the patient up in a light head wrap. The face's eyes are fully open and exposed. We also, I will place 2 small drainage tubes, and these drainage tubes sit underneath the skin, and they come out back here in the hairline incision. And we like to keep our face and neck lift patients overnight for that first night. So the next morning I'll come in, I'll take all the head wrap off, we'll take these drainage tubes out, and then we send them home in an elastic chin strap. Kind of looks a little bit like a nun's habit, but the chin strap, you can take it off to eat, you can take it off to shower, you can take it off to wash and dry it and everything like that. So it's not too cumbersome. And the drains really are just that first night, and I take care of removing all of that. So the patients go home that next day after surgery, and usually stitches and everything come out in about a week. Usually patients are back out in public, I would say between 10 and 14 days, depending on how extensive of a facelift that we're doing. Limitations, primarily, I don't want the patient picking up anything heavier than 10 pounds for the first 2 weeks, nothing heavier than 20 pounds for another 2 weeks, but pretty much within a month, they're back doing all of their normal activities. I would like to show you some results of some other similar patients just to kind of get an idea of the type of things that we can achieve with face and neck lift. All right, so I'd like to show you some kind of typical results here. Kind of go through a couple. And this is kind of a medium level face and neck lift. You see before she has kind of this jowling, a little bit of neck looseness, and then much improved jawline, much improved contour of the neck. Kind of show you from the side. Again, this is where we've got this is tightening the platysma and tightening the skin to give you better definition. We talked about kind of the corners of the mouth and the lower third of the nasolabial fold, and that looking better there as well. This is another patient. We did a little bit more. We also did a brow lift in her, obviously. But again, you see very square jawline, loose skin on the neck, and then an improvement in the contour of the face. Again, very loose skin in the neck. Nice improvement there as well. And this is a patient that we did just a mini facelift on, and her changes were not quite as severe. She didn't have quite as much going on in the neck, but you can see even with the mini facelift, you get a little bit of improvement in the neck area. The neck sometimes can be one of the more difficult areas. This is a patient that has a very heavy neck, very a lot of extra skin. We had to tighten, we had to do basically all three things here. We had to remove skin, we had to remove fat, and also tighten the platysma muscle underneath. And then that's the kind of improvement we can get there as well. Obviously improved jawline. Everybody thought she lost a lot of weight. And that's because we sometimes certainly carry our weight in our face, so that she was very happy with that result. We want to thank you all for tuning into our video today. If there's anything else you want to learn about facial cosmetic procedures or any of the other abdominal or breast procedures that we do, please do not hesitate to contact our website or our staff. And we hope you all have a great day.